So today I'm going to be preparing a medication for a secondary infusion. So I'm just going to review my scenario. I have Emma Wrightson. She is a 30-year-old female. 3 days ago she was scratched by her cat and is now experiencing cellulitis in the left arm, and she's been prescribed antibiotics, so I'm going to be administering those. So reviewing my patient, I have Emma Wrightson, born on the October 20th, 1990 with Dr. Nichols. Patient has no known allergies. She's been prescribed cloxacillin. I have already reviewed the orders to the MAR and ensured that all of the patient information, including allergies and the medication order, have been transcribed by 2 transcribers. So I'm going to go ahead and prep this medication using the MAR. To prep the medication, I'm going to do hand hygiene. And she's been prescribed cloxacillin, so I've selected cloxacillin. So doing my first check, I have Emma Wrightson. She's been giving cloxacillin, 1 gram. This is a 2 gram vial, so I'm only going to need half. It is to be given IV. This is for IV use only. It is due every 6 hours, and the next dose is due now, so I'm good to prepare this medication. I'm going to review my drug monograph. So I have cloxacillin. This is an antibiotic in the penicillin family. My patient has no known allergies to penicillin, so I'm okay to go. It may be administered by a nurse or a student nurse. The usual dose is 1 to 2 grams, and we're only giving 1. The maximum single dose is 2 grams, won't be exceeding that. The maximum daily dose is 12 grams, we won't be exceeding that. So reconstitution, it is supplied as 500 milligrams, 1 gram, or 2 gram vials. We have a 2 gram vial, so I'll be reconstituting with 6.8 milliliters of sterile water for a final volume of 8 milliliters and a final concentration of 250 milligrams. For a 1 gram dose, I'll need to dilute in a 50 milliliter bag of normal saline and administer over 30 to 60 minutes. So I've got my 50 ml bag of normal saline. I'm just going to assess my compatibility. So this drug is compatible with normal saline and D5W. My secondary bag is normal saline, my primary bag is normal saline, so both are okay. So I'm okay to keep prepping this med. So as per PDM, I'm reconstituting a 2 gram vial with 6.8 milliliters of sterile water for injection. I've ensured that this is not expired. So I'm using a 10 milliliter syringe. Blood fill. I'm going to go ahead and clean the top of this for 30 seconds and allow it to dry. So I need 6.8 milliliters. This is already being cleaned and it's dry. Oh, hello. So 6.8 milliliters here. Recapping. Ensure that I have no bubbles. Correct dose. So I have 6.8 milliliters of sterile water, no bubbles. So I'm going to put that into my cloxacillin vial. So I'm cleaning the top for 30 seconds and allowing it to dry. So administering 6.8 milliliters of sterile water to reconstitute this medication.
I will also be doing vital signs frequently. So again, if you experience any of those side effects that we talked about, please let me know.
And I'm just going to roll this between my hands to dilute the powder into the liquid and ensure that there are no sediments. So the final concentration of this vial is now 250 milligrams per milliliter. So I will need to withdraw 4 milliliters as per my calculation. Here are my calculations. So now I'm going to pull back 4 milliliters. for 30 seconds. It is now dry.
How much time is left? Like on where? On there? Yeah. 8 minutes.
Great, so I have 4 milliliters of medication. My needle is primed. No bubbles. So I've created a med label. Okay. So I'm gonna go ahead and do my second check before I dilute. So I have Emma writes in, no known allergies. She's getting cloxacillin. 1 gram, this is a 2 gram vial, so I've taken 1 gram of medication in 4 milliliters of solution as I've done my calculations. This is to be given IV. It's for IV use only, and I'm going to dilute this in an IV mini bag. It is due every 6 hours, and the next dose is due now, so I'm okay with administering this medication. I would discard those. So now I'm going to dilute in the mini bag. So as per PDM, I have a 50 ml bag of normal saline. So I'm just going to clean the end of this. And administer my 4 milliliters of fluids. Quickly recap that guy. That would also be discarded. And label my bag. My mini bag is labeled. So then I'm going to go to the bedside and I'm going to take a secondary set, alcohol swab, mini bag, my PDM and my MAR. So I'm doing hand hygiene as I'm entering the room. Patient is not in distress. My environment is clear and safe. So I'm just going to introduce myself. My name is Kaylee. I'm a student nurse. I'm going to be here to administer your antibiotic through your IV. This is going to be used to treat your cellulitis. So I just need to confirm that I have the correct patient. So we have Emma Wrightson. Can you tell me your name? Great. And your birthday? Okay. And do you have any allergies? No. Okay. Great. So I'm going to confirm I have the correct medication. So I'm doing my third check. I have Emma Wrightson. I've confirmed that this is Emma Wrightson. No known allergies. We have cloxacillin, 1 gram. To be given IV, I'm giving IV secondary for the secondary line. It's due every 6 hours, and the next dose is due now. So we're okay to go ahead. So I'm assessing Emma's IV site for any signs of redness, warmth, swelling, any signs of phlebitis or inflammation. So everything looks good. There are no clamps on. The primary line looks good. Oh, just leave it at the bedside. The primary line is labeled, and the primary bag is labeled as well, and it has not expired. And my primary rate is running at the correct ordered rate, so everything is good to go there. So Emma, today you're getting cloxacillin. This is an antibiotic that's going to be used to treat the cellulitis in your arm. And you might experience some side effects like diarrhea or nausea. So if you experience any of these, please ring the call bell and let me know, and I'll come back to help you. So I'm going to prep my mini bag. We have the secondary set here. The blue hook is used to hang the primary line lower than my secondary. So that's hung. I'm going to use this guy. And using sterile technique, I'm going to spike my mini bag. Okay. I'm going to hang this up. And using an alcohol swab, I'm going to clean the port above the pump for 30 seconds. Allow that to dry.
You guys are just under 5 minutes for those of you that are still filming. For those
Using
of you
sterile
that aren't,
technique,
you could just keep
I am
the timer
attaching
for
these.
now. Thank you.
So then I'm going to back prime my secondary bag. So keeping it lower than my primary, you can see the bubbles entering the secondary bag and leaving the primary or the secondary line.
Let's see your video.
So that is done. Ensuring that my clamp is undone. I am now going to set my secondary rate. So secondary, I've already calculated that my rate is 108 milliliters an hour. So we got 108. My final volume is 54 milliliters. 54 milliliters. Confirm secondary. Start. So now my secondary line is running. I'm ensuring that I can see 3 drops running in the chamber on my secondary. My patient is not experiencing any distress. So I'm going to sign off on my MAR. So I have KSUMSN3 that I've given this medication. I'm also going to fill out the fluid balance record to say that I have administered fluids to this patient. MAR, fluid balance record. Everything is running fine. So I'm going to return in 30 minutes to ensure that my secondary bag has fully infused and to administer a 15 cc flush to ensure my patient has received all of the antibiotics she has ordered. So I'll be back in 30 minutes to reassess you. I'm doing an exit safety check so my patient is not in distress, bed's at the lowest position, there's no environmental hazards, and I'm back, I'm done.